I'm a nurse practitioner student at Auburn University. Today I'm going to be talking about the current COVID-19 or novel coronavirus disease pandemic. SARS coronavirus 2 is a respiratory infection that was declared a pandemic on March 11, 2020 by the World Health Organization. The virus is spread person to person by aerosol droplets. After inhalation of COVID-19, virus particles bind to ACE2 receptors. ACE2 receptors are highly expressed in pulmonary epithelial cells. The virus then replicates and migrates from the upper respiratory tract to the lower respiratory tract, resulting in an invasion of pulmonary alveolar epithelial cells. From there, a cytokine storm is initiated from the release of interleukin-6, interleukin-1, and inferior beta cells. A chemoattraction is then initiated, attracting neutrophils, CD4, and CD8 cells, as well as altering B-cell differentiation. The result is often lung injury or CD8 cytotoxicity. Viral replication results in host cell destruction. As viral replication of coronavirus continues to invade healthy adjacent cells, a loss of pneumocytes occur. This leads to diffuse alveolar damage and can often result in ARDS. The spread of COVID-19 has been traced to multiple cases in Wuhan, China, dating back to December 2019. As of November 23, 2020, Johns Hopkins reported nearly 59 million cases and 1.4 million deaths worldwide. The coronavirus has four structural parts: the spike, the membrane, the envelope, and the nucleocapsid. The spike protrudes from the virus itself and is largely responsible for the attachment to other host cells. The most common diagnostic tool for COVID-19 is the PCR and is collected either nasal or oral pharyngeal swabs. Incubation period for the coronavirus is 5 to 14 days, and symptoms can present such as fever, body aches, malaise, dry cough, and shortness of breath. Complications of COVID-19 include ARDS, sepsis, DIC, respiratory failure, pulmonary embolism, and liver or kidney injury. Recovery and long-term effects vary greatly depending on each person's previous health status before COVID diagnosis and the severity of symptoms. Symptoms can range from asymptomatic to severe. Also, depending on a person's symptoms, are treatment options. These options include supplemental oxygen, antibiotics, corticosteroids, antivirals, plasma exchange, and anticoagulation medication. As a nurse practitioner student, COVID has primarily affected me by making clinical placement much more difficult. Facilities are wanting to use only essential personnel to minimize exposure. In addition, upon landing a clinical placement, it is difficult to ensure that you are able to get the most exposure to other patient populations and to treat patients other than COVID patients. While healthcare will likely normalize in the future, the pandemic has been a unique learning opportunity for me as I am in nurse practitioner school. I'm getting a first-hand experience on learning to adapt to an ever-changing healthcare system. Thank you.